if we can't spread the gospel about Mission of Mercy, how they're helping people, then we haven't helped the world.
Them coming to us as a last resort is an opportunity that's miraculous. Miraculous for them, miraculous for us.
I feel like family when I come in. That's how they make you feel.
It was just treating the patient, period. It didn't matter. Anything else didn't matter. How tall he was, what kind of hair he had, what they looked like, where they worked. We just treated the patient.
I had nowhere else to turn. My kids didn't have money because they were working to support their families. So I just thought that either if I didn't seek some type of help, I was going to die.
We never know what situation in life that's going to hit us.
We get the best treatment which is possible, even if we ourselves wouldn't have been able to afford all that.
Not having insurance is really a tough road. You don't really miss it until you really need it.
Many of the patients we're seeing now were previously covered in a healthcare safety net of some kind, and now they're not. They're free-falling. They're falling between the cracks, just like many of our other patients we've been treating for the last 10 years.
They're coming from situations that are not good, either financially or domestically or psychosocially, and they leave here and go back into those same situations. They're not situations that they can just walk away from.
As our patients come in the door, you see that fear as they walk in for the first time. And there's a part of me that understands that all too well.
What we try to do at Mission of Mercy is to treat them just like you would be treated in a doctor's office.
I took my dad to Mission of Mercy Clinic. They were very humble, friendly. He saw the angels from the angels of God.
We believe that the moment we're giving to this precious person, that we are receiving at the same time.
You look forward to seeing them. You look forward to hearing how they're doing and what happened since you were last there.
I didn't know what to expect. I really assumed I was going to be there for hours and hours and hours. My biggest fears never came to pass. I came in, I was seen, I was treated with dignity, respect. As I was leaving, I'm like, okay, am I supposed to do anything else now? And they're like, no. Be well, enjoy yourself.
I walk away with hugs. I walk away with blessings. Walk away with handshakes. Sometimes some of the men want a hug too.
Mission of Mercy is different from a lot of nonprofits because, number one, our foundation is prayer and volunteers. We don't take state or federal money, and we provide direct services to patients. So there's not a lot of bureaucracy, there's not a lot of distance between our mission and the impact that it has on the community.
We all come together to make the perfect whole. We each come with our gifts, and all those gifts together make up Mission of Mercy.
We're relying on the community as a whole to come together, and for all of us with that spirit of giving to try to best meet the full complement of the patient's needs.
We feel that we are like other human beings. Our dignity is restored in a way through Mission of Mercy. Human dignity is there.
So come with your brokenness, come with your vulnerability, and come take my hand with the faith that I've given you. Oh, comfort my heart with your kindness to even the least.
no one's denied, and no one's asked any questions other than why they're there.
Do not pass me by.
Free health care, free prescription for anyone who walks in the door. It's just an outrageous idea, really. But that's what we're called to do. I mean, that is really what God has called us to do.
Do not pass me by.
God didn't want it this way. He really didn't. And I think that He is and will continue to provide the grace to bring about the change. And when that happens, we want to be there.
Do